It's time for Live Well. This is where we delve deeper into health conversations from the African perspective and all across the world. Today, we're speaking about a conversation that could be highly stigmatized. Female sexuality or women's sexuality can be or has been highly stigmatized in many of our societies where there's a lot of purity culture and women are not always comfortable to speak about their sexuality, but also the world is uncomfortable with women's sexuality in so many ways, which makes a conversation like the one we're having today very, very important.
Purity culture.
Purity culture. So, seeing women as pure or non-sexual.
Okay.
And when women express their sexuality, then they're named in particular ways, which make them more afraid to speak about their sexuality because of purity culture.
Sure.
So, women's sexuality associated closely with purity or being pure. So moving further away from them as sexual beings,
Sure.
which they are. So today we're speaking about female sexual dysfunction, also known as FSD. This is a health issue that affects many, many, many women all across the world. Yet it is largely under discussed, and it encompasses a range of challenges of women's sexuality, from low desire, difficulty with arousal, to pain during intercourse. And today we're exploring this particular conversation, what it really means, why it happens, and how women can find healing in many types of interventions. Dr. Emmanuel Ati is a specialist obstetrician and gynecologist joining us to have this conversation with us. Thank you so much, Dr. Emmanuel, for joining us this morning. How are you?
Okay, and yourself?
I'm doing well, thank you. Thank you so much for joining us in this important conversation. And I say it's important because, conversations about women's sexuality have been stigmatized quite a lot, as you heard me say a little bit earlier on. But and because of this, so many women are afraid to speak about, the things that are happening in their bodies and with their sexuality. As a gynecologist, does this ring true for you, for someone who deals with the women's reproductive body? Is this something that women are comfortable to speak about?
Thanks for the question. And I think you hit the nail on the head. When it comes to discussing of women expressing their sexuality or problems they may have with, it's one of the issues that we as gynecologists find that they're not forthcoming. And most of it's they either present with you hoping that you treat either the gynae problem that they have, and in bypassing would actually solve the problem they have, which is the sexual dysfunction. Um, Unless you sit and basically tease it out of them, most of the time you would not get the appropriate problems that they actually come in with. So most studies will quote that maybe 30% of females have these sexual disorders, but I think it may actually be more than what we actually see or do know.
Yeah, I mean, Doctor, we don't talk a lot about female sexual dysfunction. How would you describe it?
I think we had spoken about it well from the introduction, and it's basically any sexual complaint or problem which may come as a problem of a female having issues with desire for sexual activity, issues with arousal during or the partner initiating those activities, issues with getting to orgasm, and also any pain associated with sexual activity. So that's in essence how we define it. And there are different components that comes about it. Some could be physical, others psychological, others psychosocial, or even some medical issues that actually causes these problems in the female.
I mean, what would the cause of it be? Would it be different in each diagnosis? Are there a range of issues that could affect women when it comes to female sexual dysfunction?
It's a barrage of issues. So as I said, we can easily categorize them into different aspects, and this will also basically touch on what the main complaint is. So for us gynecologists, when we're looking at these issues, we first have to look, is there an underlying condition, a medical issue? Is there a psychological factor? Is there a social issue? Because we've just mentioned social and religious aspects of it. So for us, there are different aspects. So for female, we know they go through different phases or cycles in their life. There are hormonal changes. So some, the older they get in or closer to menopause, they start experiencing some of these issues. Others may have underlying organic issues, which are maybe their hormone levels are low or imbalanced. They may have gynae conditions like fibroids, endometriosis, which causes pain during sexual activities. They may just have an infection as well, or they may be uncomfortable when they have abnormal discharges, and this also causes them not to feel confidence in their body or how they perceive themselves during these activities. So there's a whole list of them. Medical issues like hypertension, diabetes, other spine injuries, endocrine problems. So the list is endless. So as a doctor, it's up to us to try to actually tease out what the underlying condition is. And majority of the times, once you tackle those, you end up getting on top of the situation.
I see. It's. I think it's much harder or more complicated now that you mentioned that this is not just a medical issue that a woman could be dealing with. And when a woman starts seeing herself, experiencing some of these female sexual dysfunctions like low desire of sex, sexual arousal disorder, you named quite a few of them. How do they know which part of themselves is the issue, whether they have a medical issue or a psychological issue, a medical, maybe even a social issue that is the particular problem of their dysfunction?
Yeah, thank you. I think as even with our definition, female sexuality is not a straight line, or it's not a simple thing as we may think, oh, you touch her, she'll get aroused and will have the desire. Female sexuality it's more like a winding curve. So it depends on when the mental state is. Interpersonal relations, is she okay with the partner? There's nothing stressing her. What type, where she is in her menstrual cycle. So there are a whole lot of things that needs to come about. But one is a patient needs to know to themselves that, hey, there's something changing. There's a problem I have here. I need to have it checked out. Majority of the times, the female perceive it as long as their partner is happy, they are okay. They will basically deal with it. They will stomach it, and that is it. But this then prolongs the issue and can later on lead to other aspects. They will get depressed, and a whole lot of issues may come up after that. So a woman must know themselves. So the simple thing as maybe during activity, they're drier than usual, that is the first sign. And mostly we'll advise, yes, maybe you use lubricants or whatever it is that may assist in reducing the discomfort. And just by taking away that little discomfort, they get back to themselves.
All right, we need to take a break. Dr. Emmanuel, stay with us on the line. Dr. Emmanuel Ati is a specialist obstetrician and gynecologist, speaking to us and unpacking female sexual dysfunction, or FSD.
Es-tu préoccupé par quelque chose? Es-tu passionné par les questions qui comptent? As-tu une voix qui mérite d'être entendue? Eh bien, nous avons la plateforme parfaite pour toi. Téléphone-nous ou fais-nous un WhatsApp au +27 66 408 87 42 et nous te rappellerons. Sois dans la conversation.
Salut Channel Africa, ici Beno le diamant rouge et Bina l'export depuis le Cameroun, le pays des lions. Voilà.
Sois dans la conversation. Il ne s'agit pas seulement de parler, mais c'est ta chance d'exprimer ton point de vue, de partager tes opinions et de t'engager avec une communauté qui valorise ton avis. Suivez-nous sur les réseaux sociaux, visitez notre site www.channelafrica.co.za et préparez-vous à partager vos points de vue sur Channel Africa, la perspective africaine.
The G20 Summit, through African eyes, live updates, and expert voices. Only on Channel Africa.
Benjamin Moshatama and Palesa
On the move.
21 minutes past 11 o'clock Central African time. You are listening to On the Move with myself, Benjamin Moshatama, and Palesa. We're speaking to Dr. Emmanuel Ati, who is a specialist obstetrician and gynecologist, speaking on female sexual dysfunction, or FSD. And you've been helping us understand this a bit better, Sometimes we don't know what's going on in the bedroom, right? Because at times you think, no, man, I just don't feel like it. Or you're like, I'm not in the mood. And maybe things in the bedroom are not as steamy as they used to be, doctor. Sexual desire, is it an indicator that there might be something health-wise that's happening when we speak about this matter?
All right, thank you. So desire comes about in different forms. And as I had alluded to earlier on, it depends whether you're looking at the female side or the male side. The female side is much more of a very complex issue for desire. So you start talking first. So desire comes from just simple communication. Whether they're talking to you, they understand the partner, they get in to understand what the partner is trying to indicate. Then obviously the bedroom, you need to have the right mood. So if a simple example, if I'm angry at you, the way I talk to you differs from when I'm very happy and lovey, my approach to you will be different, and the reception is also different. So the psychological aspect is very important. And once this is become unbalanced, that's where we start seeing the issues happen. So for arousal or the desire, there are a lot of factors that I will have to say, and it's not a single thing that will pinpoint that, oh, there's probably a problem. But if this now goes on for a longer period, when you yourself realize that there's no issue, that there's not a problem that you can say is causing you not to have a desire for your partner, or it's now unlike you. You used to initiate activities, now for 2-3 months you're not there, then that should then start flagging that you need to actually check, hey, what's going on? Or if it's now your male partner that's the only one always initiating, you need to now have a look and see that, hey, I need to check, maybe there must be a problem here.
So, when one feels like they may have female sexual dysfunction, any one of the ones that we've mentioned in the conversation so far, should the intervention of the FSD be multifaceted, or should it just be focused on one at a time? So, for example, should I go to a gynecologist and look if it's just medical, or should I seek a kind of gynecologist, maybe even a psychologist or a therapist to speak to me on an emotional side, just to try and see and balance where exactly the issue is? So is it one directional or multifaceted?
I think, again, you just hit the nail on the head, because majority of the times, most female will present to their general practitioner with vague symptoms. By the time they come to a gynecologist, most of the time, 98%, we try to actually make the diagnosis of it. So where to start always is the problem. So the easiest part is start somewhere. And as I've said, we need to identify where the problem may be coming from. So rightfully, it's a multidisciplinary approach. If there is a gynecological issue that we identify that may attribute to it, yes, then treating that may inadvertently resolve this FSD. Whereas if it's a social issue or a psychological issue, then that must also we bring in our counterpart to try to tackle it on that aspect. So rightfully, yes, we call it a multidisciplinary approach to treating this condition.
Mm-hmm. I mean, we're getting older, doctor, and, one would say maybe at a particular age, female sexual dysfunction is normal, or even male sexual dysfunction is normal. Does age have anything to do with it?
It definitely does. So, as I mentioned, the change in the hormones in a female has a great impact on either their bodily function as well as their psychological aspects. So, for females, most of the time, the older they get or getting closer to menopause, yes, their libidos decrease around that point. Whereas men, this is when we actually now start getting more active. So the type of dysfunction differs and the underlying causes also differ. But definitely, yes, age does play a part in it. And especially for females, getting closer to the menopausal age, that's when now they tend to more lose interest in more active activities in the bedroom.
And in that instance, especially if it's like a hormonal issue, maybe a menopause issue or perimenopause issue, what are some of the interventions that women like that who still want to, of course, be sexually active but are presenting with these issues? How can they deal with that?
Okay, so that's also a good question. For my approach, usually it's a lifestyle change, a psychological change, as well as the medicinal aspect that comes in. So for female, menopause, it's a hallmark of a big change in their lifestyle. So sometimes supplementing what is deficient at that point may help. So we then talk about hormone replacement and things like that. Some of them just to ease them onto the other side. There are other non-hormonal treatment that we give to help as well. The major parts with menopause is now they'll complain with hot flashes. They're uncomfortable, basically. So once you make them more comfortable in their skin, then they probably try to behave as they were prior to getting to that stage. So the different approach to managing once they get into the menopause aspect, there are, as I've said, medicinal lifestyle changes. Other people start doing yoga, which helps them center themselves well. And some of my clients do say they feel better and they relate more well. They accept their body, all the changes that are happening. They're able to then accept it better and move on with life.
Dr. Ati, I mean, fantastic advice. Can we get you online where we can just go maybe see a video to connect maybe with you online in ways that are more practical to get more of this advice?
Yes, we do. I'm on Facebook. Handle is Dr. Ati. Also on Twitter, similar, Dr. Emmanuel Ati. And also on Instagram, the same handle.
Fantastic. Thank you so much, Dr. Ati. Thank you for being so practical with this one and making it so easy to understand.
It's a pleasure.
That's Dr. Emmanuel Ati, a specialist obstetrician and gynecologist joining us. So what's your take on that one? We should talk about that, Bali, that conversation around what
Purity culture?
Purity culture, because it's very huge in our community. What's your take on that conversations? Give us your thoughts on our WhatsApp number, +2763 469126. It's time for us to move on right now. Let's get the latest sports.